Reverse shoulder replacements are becoming more commonly used worldwide. They're called reverse shoulder replacements because the shoulder is normally made up of a ball and a socket, and in a conventional shoulder replacement, we replace the ball with a metal ball and stem and the socket with a plastic socket. In a reverse shoulder replacement, we change the geometry of the shoulder. So we replace the socket with a metal ball, and we replace the bony ball with a plastic socket and a metal stem down the arm. This is done to compensate for torn tendons around the shoulder and allows the deltoid muscle, this big muscle on the outside of the shoulder, to drive the arm instead of the torn rotator cuff tendons inside. Reverse shoulder replacements are used either for trauma, where the fractures are so severe, usually in the elderly, that the rotator cuff tendon attachments are fully torn, or in degenerative conditions, the special types of arthritis that can occur after chronic rotator cuff tears. A reverse shoulder replacement is quite a reliable operation for pain relief and can restore a significant amount of function for patients. They also can last now up to 12 to 15 years. My patients who require reverse shoulder replacement can expect this to be done under general anesthetic with regional anesthesia to help with the pain post-operatively. Patients are usually in hospital up to 2 nights and can be in a sling for up to 2 weeks. We encourage early return to movement with a physiotherapist, and patients can expect to require about 6 months of physiotherapy to get to their best. The shoulder usually is at its best at about a year after the operation. Although this operation is reliable at relieving pain, the function after any shoulder replacement is not that of a 20-year-old shoulder. So I often have to remind patients that this is a new shoulder, but not a 20-year-old shoulder, and all replacements have their limitations. Some patients are able to get almost full movement back after reverse shoulder replacement, but it's quite often that there is some limitation after reverse shoulder replacement compared to your unoperated side.